Hi, my name is Dr. Babak Edraki. I am a gynecologic oncologist and I practice in Walnut Creek. I started my journey by going to UC Davis for undergraduate studies and then to George Washington University in Washington, D.C. for my medical school. After that, I did an internship at Santa Clara Valley Medical Center and then did my residency at Stanford University Medical Center. After completing my residency, I did a fellowship at Yale University in Connecticut. I am currently the Director of Gynecologic Oncology and Women's Cancer Services at John Muir Walnut Creek. I'm going to talk to you about vulvar cancer. Vulvar cancer is often misdiagnosed. Because there is irritation of the vulva. The vulva is the outside skin, just outside of the vagina. And that irritation can oftentimes be mistaken for a vulvitis, an inflammatory process of the vulva. I see patients with vulvar cancer who have had all sorts of treatments with different types of creams to try and get better, and finally somebody does a biopsy. So if there is an issue with pain or discomfort of the vulva that doesn't go away, get it biopsied. It's a very simple, easy office procedure that your gynecologist and also some primary care physicians can do for you. Vulvar cancer is painful. It can cause issues. There are many different types of vulvar cancer, but the main type is called the squamous cell cancer of the vulva. These cancers have similar risk factors to cervical cancer. HPV is often a causative factor. But also one of the other things that can cause vulvar cancer is chronic irritation of the vulva. People who have issues and are wearing diapers all the time and it's wet around the vulva and there's always some sort of a vulvitis or inflammation going on. For whatever reason, we see the incidence of vulvar cancer going up in these patients. Also, patients who have this inflammatory condition of the vulva, which is called lichen sclerosus and atropicus, this inflammation of the vulva which causes atrophy of the skin of the vulva, and it's very uncomfortable. It causes burning and itching and everything else. About 3% of those patients will develop vulvar cancer throughout their lifetime as well. So again, those patients with lichen sclerosus, it is important for them to have usual regular follow-ups. The treatment of vulvar cancer depends on the stage and how big it is. Vulvar cancer can oftentimes metastasize to the lymph glands along the groin, even with only a small amount of invasion into the subcutaneous tissues. You can have nodal metastases. There are techniques for doing sentinel groin lymph node biopsies and also a more formal, thorough lymph node dissection of the groins as well. And again, this is a decision that will need to be individualized based on your type of cancer and the symptoms and the physical findings when you discuss it with a gynecologic oncologist. Radical vulvectomy, as horrible as it sounds, is oftentimes life-saving, and the relief from pain is almost immediate. I have had so many patients who have had big cancers of the vulva who are very uncomfortable, cannot sit down at all, and they have surgery, and the day after surgery, they're still in the hospital. Instead of them using their morphine or their pain medications, they're thanking me and they're saying, "Oh, I feel great. It doesn't hurt at all anymore. It's not like what it was before." So the surgical management of vulvar cancer, again, is important. For cases where surgery is not feasible, or for advanced cases, radiation therapy plus or minus chemotherapy is effective.